The FiliSlide Biotexis in-bed care management system is brilliantly simple and versatile. So much so that you may find ways to use it that we haven't even thought of. You can adapt the product to suit the needs of whoever you are taking care of. Here are just some of the tips and suggestions we didn't have time for in our other films. We strongly recommend the loosely looped tuck as the main way of securing the excess overhang of the sheet at the side of the bed for practical, hygiene and safety purposes. When grasping the sheets, always be sure to use a grip that is comfortable to you and doesn't cause strain on your wrists. We strongly recommend that the carer's nails are short and all hand jewellery is removed to prevent any risk of damage to both the patient's skin and the Biotexis fabric. Mobility and independence can be maintained with those patients who struggle getting into or out of the bed, as the sheets make it easier for them to not only slide but also pivot turn themselves without causing any friction or shear. The bed sheet can also be used to avoid friction and shear on the patient when alighting the bed using a mobile hoist. When turning a patient with a turning aid, lowering of the bed may also be used to provide additional tilting of the patient if required. Always turn a pressure relieving mattress to static or nursing mode when you are moving or repositioning patients in bed to reduce friction and shear on the patient's skin and to reduce effort for the carers during the move. Turn it back to dynamic mode after completing the move. If the patient suffers from nocturnal incontinence, for example, the bed sheets have a hydrostatic head and are resistant to fluid penetration over a short period of time. The fluid can simply be wiped off and dried with minimum disruption to the patient's sleep. We do not recommend the use of memory foam as a mattress base with any patient that has to be either moved by carers or has a reduced ability to reposition themselves in bed.